Hello again. Welcome to Ask Dr. Pane. We got a great question here. A woman who has roughly 400 cc breast implants in place. It's not mentioned whether they're above or below the muscle, but they would like to be smaller. They think the implants are too big for them. And they want to know, do they need to have a breast lift? This is a very common situation, and I'm going to say when we describe the pictures, we're looking at rounded breasts that are pretty full. Has been a couple of months since surgery, so we're mostly through the recovery and probably not going to change very much from here. But the breasts are kind of pointed a little bit downward. The angle is a little bit downward slanted. Now, a couple things here. When you are going from larger implants to smaller implants, most of the time you're going to need to consider a breast lift. Not always. It really depends on the type of tissue. In this particular case, because I see things pointed down, and the implants are about 400 cc's. When you go down in size, I tell people to think about, a reasonable jump, whether you're going up or down. I usually like jumps at least of 100 cc's, often more, because if you're going to go through a secondary operation, you want to see the result you're looking for. If you go, say, 50 cc's up, 50 cc's down, you'll see that sometimes with beginning surgeons. Someone will come into me and say, well, I had 325 and I went to 375 and I don't look better. I'll say, yeah, because you really needed to go from 325 to, in the upper 400s to see, a difference. Going down, it's the same kind of thing. If you want to be smaller, you really want to be smaller. The question is how much. And here, because when you're going to go smaller, there's going to be extra tissue left over. That has to be accounted for in some way. Now, you don't always have to have a breast lift. It depends on the type of tissue you have and your tolerance for scars and how good you want to look in clothes and out of clothes. Remember, sometimes people just want to have a big, full, in a shirt look or a smaller look in the shirt, and they're not as concerned with the scars, even if things aren't going to look great with the clothes off. That's okay. It's just important to understand what kind of result you're going to have and make sure it's what you're looking for. The scars aren't for everyone. In this case, I would think, again, getting back to the answer, downsize, think about a lift. It's probably going to need to be a circular areolar lift at a minimum, and probably a vertical lift, depending on how small you want to go and how much of that extra tissue is left. So again, going down or up, consider larger jumps in the volume size to make sure you're really getting what you're looking for. And you go from big to small, oftentimes there is tissue left over. Most of the time that's going to need some kind of lift, but not always. You're going to need an in-person consultation with the right surgeon to make sure you get the plan and the results that you are looking for. So I hope that helps, and we will see you next time.